Stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
A moment of silence for our troops on active duty. Thank you. Can I ask the council to introduce himself, starting with far right?
Ellen Sapo, District 3.
Rich Meisenkowski.
Eric Carlson.
Mary Fortier.
Calvin Brown.
Town Clerk Teresa Peck. Assistant Dawn Bella.
And Mayor Ken Cockane. Councilman Martin will be here shortly. He's just finishing up at another meeting. Item number B, presentation by Connecticut Conference of Municipalities concerning free prescription drug program for city residents and approval program.
Thank you, Mayor. Thank you, Council, for having me here. My name is Gina Calabro. I'm with the Connecticut Conference of Municipalities, and I'm here tonight to talk to you about a program that we launched 2 years ago that we now have 121 municipalities in, and we hope to see Bristol join as well. It is the Prescription Discount Card Program. What it is, this is free to the city, this is free to the taxpayers. There's no cost whatsoever to join this program. We launched this program, as I said, 2 years ago based on that they've been doing this program in New York for the last almost 10 years now. We found that they were saving the residents money, and this was prior to Affordable Health Care Act coming out as well, where we were seeing in Connecticut that 11% of Connecticut did not have either medical insurance and definitely did not have prescription insurance. What this is a card that we mail out to all the residents with approval from the mayor and any other council members or committee members that need to approve this. It is mailed to every resident. It goes out to residents. There's no information that we retain at all. So there's nothing that they need to fill out in advance. There's no forms, there's no age limit, there's no income requirement to be part or to use this card. The main reason for the card was initially for people who were uninsured. We still find with the Affordable Care Act, there's quite a few people that have picked up insurance but still do not have valid or really good prescription insurance. But we've also found in presenting this program, there's quite a lot of people that don't have full insurance, meaning that you may have prescription insurance through your employer or through Medicare, but not everything is always covered. This card will save in generic drugs anywhere from 10 to 30%, on brand names from 20 to 80%. What I've included in the packet, some of the information, just to go over it with you quickly, is there's a map of all the municipalities already in the program. As of end of August, we have saved Connecticut residents over $5 million in prescription costs by using this card. How I know that is that every municipality in the program, I send them a monthly report to let them know how many cards are being used, how many claims are being filed, and what the discount savings are both by percentage and dollar savings. There's also a list of all the pharmacies in Bristol and surrounding areas that will accept the card. This card is also nationwide because it's corporate CVS, Rite Aid, Walmart, Target, Walgreens, also Stop and Shop and Big Y pharmacies also accept the card. In the 2 years that we've been doing this program, we have not had an issue with any of them accepting the card. And again, it's based on the drug, on what the discount will be. Also, there is, and I also put some sample monthly reports in there so you can see how some of the other towns are doing with the program. Primarily, as I said, the program was set up to be for prescription discounts. The reason that we decided, and this also, so that you know, was vetted through the board, the CCM board, which is made up of 23 different municipal officials. So this was also something that they vetted, as well as we've also vetted the agreement through 120 municipal attorneys as well to make sure that what we're offering is, because we're following HIPAA laws and everything as well, because we're not collecting any information. What we also provide through this program, though, is there is a vision discount. that you can use it for glasses, frames, contact lenses, and even eye exams. If you do not have a vision plan, this is one of the reasons why we mail this out to every resident. This goes out to anyone that has a P.O. box and a street address. We purchased a resident occupancy list from the post office to mail this out. I do know that Lens Crafters, Walmart, and Cohen's Optical, they do accept the card. I believe even Sears for the vision. I will tell you a story myself. I used it. We have a vision plan at work, but it's either glasses or contacts. I was able to get, normally 6 months worth of my daughter's contacts were $150. I got a year's worth for $179. So in that respect, there's savings for all of us. There's also hearing aid and hearing services, that there's a toll-free number. I do want to mention that all of this is administered by the vendor that we went with, which is ProAct, who is based out of Syracuse, New York. They do all the administration. There is no administration on the side of any of the towns that we've been dealing with for the last 2 years. That's pretty much the program. As I said, every step of the way that we do this, the card itself is designed and approved. We do a flyer that we will print and make sure that there's copies. We supply initially 50 copies to the city that is also approved. And we also do some posters so that we allow you, if you want, to put them around. Also, we visit every pharmacy prior to the cards mailing out, so that we make sure the pharmacies are aware that the city of Bristol is involved in the program now. So we have visited pharmacies in 120 municipalities at this point. Matter of fact, I have 2 municipalities that are going to be mailing out in 3 weeks. The whole process takes about 6 weeks from the time that we receive the signed agreement, and as members of CCM, you're eligible for this program.
Thank you. Any questions?
Hi. I'm actually an employee at the Connecticut Pharmacists Association, and I had some concerns that I think I had expressed to the controller, and I just wanted to see if you could clarify some of the issues. The pharmacy benefit manager that you're using, ProAct, do they sell the data that they retain from processing the claims for people's disease states and then send that back out to people who are interested in obtaining that data about patients?
No, they do not. As a matter of fact, that is listed in the agreement that is signed by the city and all the towns, that all that information is not to be used for any purposes. As a matter of fact, everything that they receive is nothing, has no personal information in it. They receive, and I'm sure you're aware of National Pharmacy Clearinghouse, they're receiving just from the membership numbers and the group codes that are on the card, because they're random. All they're receiving is like the group code for Bristol may be SBR, or CBR. Some of them are like, usually it starts out with a T for town or whatever. That's how they send me the reports, but none of this is retained for any purposes.
Okay, and how do you safeguard that with ProAct? How do they prove that to you?
Well, there's a couple of things. One, as I said, through the agreement that I know that your municipal attorneys have. The other thing is that if requested, they will also send you, which we have done for some times as well, saying that what information exactly is retained so you have it on file. We even had liability, I'm trying to think of the term to use, forms that were filled out just to say that they're limited, as far as their liability for this information as well. So we will supply all that.
Okay. I'm a little concerned with whether there truly is a need. I think it's wonderful that we're offering this to our citizens, but from a pharmacist standpoint, I can tell you that even though the Beacon pharmacies, which are our only remaining independent pharmacies in the city of Bristol, may have, through their PSAO, an agreement covering ProAct as their pharmacy benefit manager, nobody has walked in and talked to date to Bob Wallenberg at Beacon on South Street to tell him that he is now going to be taking a reduction on what is already a razor-thin profit margin for him, not because of you or us or any insurance, but because of the drug manufacturer prices. So I'm just a little concerned that when they're already at a very difficult position, those are the only businesses left. Not the chains, but the independents who are contributing in a charitable way back into our community. And now we're asking them to take even more of a deduction off what that very slim profit margin
Well,
is.
first of all, it's not ProAct, it's Restat. Restat is the one that sets if you look at the card, the Restat BIN number that's on the card, and I believe Beacon's part of Restat, so they're already accepting. that's who's setting the discounts. It's not ProAct. They're actually working through Restat. So if there are, and that's why all the corporate pharmacies are doing that, because it's through Restat. So if they're already accepting Restat discounts, there's not additional margins that they're taking on this. One of the reasons that when I decided to go with ProAct was I looked at 5 companies. We did our due diligence as well, just to make sure. I had quite a few. Actually, out of the 5, 2 of them wanted to charge $1 per card. I had another one who wanted to charge the pharmacies an additional anywhere from 75 cents up to $3 per prescription. The reason that we went with this one is I looked into Restat, and because all of these corporate pharmacies, including Beacon, are part of the Restat program, there was no additional discounts that they needed to take.
All right, so that you've already checked that.
Yes.
Now, from a CCM business strategy standpoint, what do you stand to gain from offering it? Is it strictly a member benefit?
Yes.
And there's no profit that CCM
The
loses
only
from?
thing we get, that what they send me is, because of all the marketing that we do, I get, so far it's been like about maybe $4,000 over 2 years, just to help with the marketing stuff. So it's like 10 cents per prescription that they'll come back, but again, it has to be a verified claim or whatever too. And it's just help to us to market the program. Outside of that, this is just a service that we're providing. My job is I'm the Director of Member Services, so I'm always looking for programs to bring to the towns and cities that can help. We also offer like we have energy programs and other things as well. So this is just one. The reason that I like this one was this is the first program that we were able to bring to the residents. And to your question as far as residents using the card, I believe that what we have found, especially with the senior citizens, and I do a lot of presentations at the senior centers across the state, we have found with the donut hole that many of them reach a certain level and they have to start paying full price. And if they're towards the end of the year, this gives them the ability, and I've had many senior citizens come to me and say that they've been able to use the card and save quite a bit because they couldn't afford to pay full price. So it's not, we agree that it may not be for everyone, but there hasn't been a town or a city yet that residents haven't used the card.
Do you have any examples of, from a formulary standpoint, what may be covered that would not ordinarily be covered? For example, what a dental product, prescription-based, that maybe somebody doesn't have dental insurance, would that be something that this card could pick up?
Possibly, as long as it's something that has to be filled at a pharmacy, first of all. Pet prescriptions, as long as they're human-based and they can be filled at a pharmacy, veterinarians can write a prescription and you can use the card. One of the girls that works for me, her dog was on phenobarbital, and she was paying the veterinarian $65 a month, and I asked her, let's see how this works. She went to write it, she's paying $28 now using the card. So for pet prescriptions, there's pet prescription plans out there, there's medical plans for pets, very few people take them. This is another opportunity to use in that way. As far as specific drugs, what we have done is there is a website we've set up called ctrxdiscountcard.com. On that site you can go to and actually put in the drug name, your dosage, how many times a day you take it, whatever it is, and you put in your zip code and anywhere from a 5 to 25 mile radius. It will then redirect you to the Restat site, part of the site, and tell you exactly what the cost will be at whatever pharmacy. So it will break down all the pharmacies in the area based on your zip code and the distance that you're going, and it will give the prices at that point, both generic and brand name. And as I said, brand name is not going to be, much of a discount because they are going to be at a higher full price value or retail value to begin with, but on the generics there's quite a bit of savings.
Have you ever seen, from a customer service standpoint, any situation arise where the card is presented for a formulary that one would assume be accepted probably on the generic side, and have the pharmacist at whatever pharmacy say that you'd be better off paying at a cash value based on the prices higher than what from the computer one says?
No, I have never had that situation. I have heard of some of the corporate pharmacies like CVS or whatever, that because they offer their own programs at a cost, a yearly cost, they'll say, well, if you buy our card for $25 a year or whatever, you're going to get a much deeper discount. That's the only thing that we've run into.
Thank you.
Any other questions? I'll say that as an insurance agent by trade for 25 years, I did sit in on the insurance meeting that this was presented to at the Board of Finance. and I think it's a home run for the city of Bristol. CCM, we pay a lot of dues, and to offer our residents something that they don't have to pay for. Some may never use it, some may use it all the time, but it's something we can take advantage of, and I think it's a great program. I thank you for coming. I have a motion to be read. Someone care to read it? It's on the link. Okay, Joe. Thank you.
I hereby move that the City of Bristol enter into a service agreement with ProAct Incorporated to provide a discount card program to participating pharmacies to all Bristol residents. I further move that the mayor or acting mayor be authorized to execute any necessary documents and that the matter be referred to the Corporation Council for review.
Second.
Motion made, seconded. Discussion. Hearing none. All in favor?
Aye.
Opposed? One abstain. Opposed? Motion passes. Thank you very much. Item number 2.
Approval of minutes of the regular city council meeting on September 9th, 2014, and the special city council meeting on August 18th, 2014.
So moved.
Second.
Motion made, seconded. Discussion. Hearing none. All in favor? Aye. Opposed? One abstain.
Wasn't there.
Okay. Motion passes. Item number 3. Public participation. In the first one, we have Michael Dudcott.
Michael J. Dutko, 116 Lewis Road. And what I have to say, more or less, is directed toward the general electorate. And this involves the ballot question coming up in November 4th on Election Day. I didn't get a chance to go to it on July 30th. I guess there was a special meeting granting this special privilege of the City of Bristol, granted by the state. I guess there was a full meeting on July 3rd. I didn't get to it, discussing it. I actually don't think what I would have said at that meeting would have made any difference. It's been adopted, and I'll just read it. It's going to be a question for everybody on the November 4th election sheet. Question number 4 is, shall the City of Bristol approve the City Council resolution dated July 30th, 2014 that adopts the Connecticut City and Town Development Act, which grants additional authority to aid and promote industrial and other forms of economic development? Now, one of the parts of that, I've had experience with it in the past. Even 15 years ago, I attended and was against this I guess, the power granted by the state. What's a hidden corollary of it is the power of eminent domain. And I've had a horrible experience from the City of Bristol with this power. This is in this extra act provided by the state. I view it as a dangerous power, granted as an extra. And as practiced in the past with the city, I don't advise the general electorate to adopt it on the ballot box. In general, it can be a threat. It can be a threat to some of the neighborhoods. It might be used with the BDDC, with the Renaissance Project. If whatever happens there, it can also be used to take over. This might be speculation, but it can also be used to take over by eminent domain some of the poor areas surrounding the downtown. There's low-income housing here, and you could put it under the category of blight and whatever. This act could take away housing on Summer Street, on West Street. I believe there are other sources of grant money. There are the BDC, the Bristol Development Agency Authority, I guess as a grants administrator. A good, worthwhile project maybe in the future is renovating the old Memorial Boulevard auditorium. I'm sure there are many other sources to get grant monies for this town. It doesn't have to be through an additional power provided by this Connecticut Act. So I emphasize and I advise the general electorate not to adopt this when they get to the election site and on the election ballot. I do not advise them vote. I advise them to vote no. Do not give the city of Bristol this extra power. It's a dangerous power with that hidden corollary of eminent domain. It has not been practiced. The last time it was practiced here, it was a horrible situation. So to the general public, I advise vote no for question number 4 on this November 4th ballot box.
Thank you. Ed, you got your, thank you, John. Sean Lewis.
Good evening. I reject the notion that this is a 3-ring circus. I think the mayor does a fine job as a moderator.
Thank you.
And I've got more kudos to give if I don't run out of time tonight.
Why don't you start with those?
Okay, well, I want to thank you, Mayor, for Your Honor, for bringing up the referendum initiative. I appreciate that. I want to thank Council Lacey for providing me with some information when I was curious about what was going on with a missing meeting. And I want to thank the BDA and the council for getting the BDA's minutes on the agenda center, or the BD's. I also want to thank Councilwoman Zappo for bringing up the issue of public debt in the newspaper and addressing it, and at least acknowledging that it is an issue, not just for me, but for many people in the city. And I found that out by talking to many people. There's also some legitimate issues that I have in regard to regionalism. It's not conspiracy theory. I read a report from the Legislative Program Review and Investigations Committee from 2007. It's not really outdated because you're looking back at the POCD before this one that we're doing right now, and there's been changes in the law. But if you read that, you can see in some towns local officials are concerned about the loss of autonomy. And if their town joins an effort they cannot control completely. They worry that if they agree with the decision now, in the future, they might find their town is required to give up revenue or provide a service or increase level of service they would not have chosen. And I'm sure you know what I'm referring to. Actually, if you read a little bit further in that, the state is basically saying we could force you to do that if we really want to. It says, as the continuum moves towards what is often described as a top-down approach for regionalism, the state takes a more active role ranging from offering incentives to towns for voluntary cooperation for providing funding only when specific results are achieved. At the next stage, RPOs can operate as sub-state districts with independent revenue-raising powers. Other single-purpose regional entities could be consolidated into strengthening RPOs along with authority over certain land use decisions, as well as administration and/or operation of certain region-wide functions. At the extreme, the state either performs the desired tasks itself. Also in that report, it speaks about the State Conservation Development Plan and promoting the responsible growth principles to which our downtown redevelopment is central on. Also, I did some more research into the analysis of impediments of fair housing choice, which was prepared by Rocco Kennedy Consulting here in the city, February 2011. They came to the conclusion that we have a lack of accessibility to public transportation. The City of Bristol recognizes the availability of accessibility to transportation are important factors which impact upon the income and earnings capacity of residents, and especially among the low and moderate income population. The West End Neighborhood Study reaffirmed this entity as an important factor in making housing opportunities available to residents in the neighborhood. Now, if you read the 3-year CAPER report, which is made available September 11, 2013, it says we took action on that. The BDA staff consulted with the CCRPA, the Central Connecticut Regional Planning Association, for updates in transportation issues. The CCRPA is representing Bristol in the busway project and will coordinate improvements accordingly. I know I already spoke about how the state is looking to relocate people along transit corridors. I'm not sure if we have any control. And then flipping through the news, I found out who the conspiracy theorist is. I think it's Tom Foley, because the headline says that Daniel Malloy is driving people out of their cars not to mass transit as part of a progressive agenda that he does not support. Interesting, because if you go to the CT Fast Track website, it actually says that. Keep more money in your pocket, get on the bus. So there's your economic development. I think we can do a lot better. Thank you.
Thank you, Sean. Frank Kramer. Been a while since we saw you here, Frank.
No, it was about maybe 2 months ago.
2 months ago?
I think it was, yeah. I remember Mr. Monty was here.
Okay.
So you might know exactly what that was. Thank you, Sean. Frank Kramer, 40 Crescent Drive, Bristol, Connecticut. Just a few days ago, the Walmart Corporation informed its employees that tens of thousands of them will be losing their health coverage. The corporation also said that it's not anything to worry about. Everybody else is doing it. This probably won't resonate with more than half the political divide controlling this town, but it should. And here's why. One, because Walmart employs the largest single group of Medicaid recipients in this country, and let me hazard a guess, probably Bristol as well. Reason number two, Walmart also, not uncoincidentally, employs the single biggest group of food stamp recipients in this country. And I hazard a guess that probably Bristol as well. Now, the fact that the owners of Walmart, the Waltons, own more wealth than over 40% of all Americans, that's right, that's 40% of all Americans, may matter to few, if any of you, on the dais today. But it should, because it's not any Walton who's paying for those food stamps and all that Medicaid. It's everyone in this room, in this chamber today. It's independents, it's Republicans, and I regret to say some so-called Democrats, whether sitting up here now or running for state senate or the House, with the remarkable exception of Mr. Santorso. Democrats who, whenever walking near the phrase income inequality, that's something that's never been mentioned in this town or in this election, either run for the hills or for the nearest necklace of garlic cloves. Here, income inequality, it's not going to bite you like a vampire. It really won't. But it will bite the 10% plus growing poverty in Bristol, and also the 25% in Bristol who go to bed every night with food insecurity. They're wondering where the next meal is coming from. I think some of you know that figure, but maybe some of you don't. That's largely women and children, and they're wondering where the next meal is coming from. All I submit here is let a discussion begin to mitigate the end runs of the Waltons of this world and consider crafting an ordinance for a living wage, and not just a minimum wage, because $10.10 on the face of it, as you all know, is laughable. Seattle, Chicago, D.C. have crafted ordinances to that effect, as in smaller towns as well, and successfully, and not with the red herring of inflation, no loss of jobs. I've heard the word leadership mentioned quite often, bandied about here. Well, I posit that leadership starts here
with just a discussion. Just talk about income inequality whenever you guys meet, because there's plenty of it here. And this is the city with all heart, right? Thanks very much.
Thank you.
Yeah.
Kim Valente.